Headaches. Ugh. If you get them, you know exactly what I'm talking about. They can just completely derail your day, your work, your social life, everything. And you know, they're one of the most common things people deal with, but figuring out the real cause can be such a mystery.
Just take a look at this number. The World Health Organization says that nearly half, 47%, of all adults have had a headache in the last year. That's a massive amount of people just trying to get through their day in pain.
But here's a thought, and it might just change everything you thought you knew about your headaches. What if the source of that pounding, that ache behind your eyes, what if it's not actually coming from your head? Okay, let's dive into this. We're talking about something called a cervicogenic headache. Now I know, that sounds super technical, but the idea is actually pretty simple. Cervico just means your neck, your cervical spine, and genic means coming from. So it's a headache that's coming from your neck. It's what's known as referred pain. Basically, the nerves in your upper neck and the nerves in your head share some of the same pathways. So when something in your neck gets irritated, your brain kind of gets its wires crossed and thinks the pain is coming from your head.
So how on earth can you tell if this is what's happening to you? Well, let's play detective for a minute. We're going to follow the clues your body is giving you, and our investigation starts right here in the neck.
Okay, clue number 1, and this one is a biggie. Start paying really close attention to what happens when you move your neck. Does turning your head a certain way make the headache flare up? What about just holding your head in one position for a long time, like when you're working at a desk? This quote from a physical therapist is just the perfect example. It shows how something totally normal, something you wouldn't even think twice about, like chatting with a friend at a bar, can be the very thing that triggers the pain and reveals that critical link between your neck and your head.
Next up, clue number 2. We're talking about stiffness. If you feel like you just can't turn your head all the way, or if it feels really tight and just painful when you try, that's a major sign. You see, when the joints in your neck get locked up and can't move freely, everything around them, the muscles, the nerves, gets irritated, and that irritation can be the direct source of your headache.
For our third clue, all you really need are your own fingertips. Try gently pressing on the muscles in your neck, especially right where your neck meets the base of your skull. If that area feels sore or tender when you apply a little pressure, that is another really strong indicator. It makes sense, right? Those muscles attach directly to your skull, so any tension there can easily travel up and feel like a headache.
Clue number 4 is all about location. A classic cervicogenic headache isn't just a random pain all over. No, it usually follows a very specific path. It often starts right at the base of the skull, typically stays on just one side of your head, and then it can kind of wrap around, causing pain in your temple or even right behind your eye.
And our final clue. Let me ask you this. Have you ever noticed that a good massage or a trip to the chiropractor makes your headache feel better? But then, a day or two later, it's right back? Well, that temporary relief is a huge hint. It tells us that the problem is almost certainly coming from your muscles and joints, because you're treating the source in the neck. But if the pain keeps returning, it means we haven't fixed the underlying cause yet. Okay, so if all these clues are pointing directly at the neck, what's the most likely suspect behind it all? Well, for so many of us in this modern world, the answer is something we do for hours and hours every single day.
Meet forward head posture. You've probably heard it called tech neck. It's that posture we all fall into, right? Head jutting forward, hunched over a laptop, or staring down at our phones. It is one of the most common postural problems today, and it puts an incredible amount of strain on your neck. Now, get ready for this, because the physics of this are pretty mind-blowing. We're not talking about a little bit of extra stress here. For every single inch your head drifts forward from your shoulders, it adds about 10 pounds of extra weight for your neck to support. Just think about that. If your head is just 2 inches forward, which is pretty common, you're basically asking your neck muscles to carry an extra 20 pounds around all day long. No wonder they're screaming.
And this constant strain just creates a total mass of muscle imbalances. The muscles in the back of your neck get crazy overworked and tight. Meanwhile, the muscles in the front get weak because they're not being used. This whole imbalance squishes the little joints in your neck, causing inflammation and irritation that sends those pain signals shooting right up into your head.
Okay, but here's the good news, the great news actually. If bad posture is the problem, then better posture is the solution. And it doesn't have to be some complicated, overwhelming thing. So let's get into the action plan with a few simple exercises you can start doing like right now.
These 3 exercises are a fantastic place to start. First, the chin tuck. This one is like the direct antidote to tech neck. It strengthens those muscles at the front of your neck. Next, the shoulder blade squeeze.
This fires up all those important muscles in your mid-back that help pull your shoulders back where they belong. And finally, a gentle lateral stretch. This helps loosen up those super tight muscles on the sides of your neck. Seriously, just doing these a few times throughout your day can make a world of difference.
Now, while these self-care strategies are really powerful, it is also absolutely critical to know when it's time to call in a professional. Not all neck pain is created equal, and some symptoms really do need a doctor's attention.
So let's make this crystal clear, because knowing the difference is so important. You should schedule a visit with your doctor if the pain just isn't getting better after a few weeks, or if it starts radiating down your arms, or if you feel any weakness or tingling. But, and this is the crucial part, you need to seek emergency care if you have severe pain after an injury like a car crash, if you suddenly have weakness in an arm or leg, or if you have severe neck pain along with high fever. Those are red flags you can't ignore.
And so, we come all the way back to this one simple but really powerful question. For the millions of us dealing with headaches over and over again, could the answer not be in a pill bottle, but in just looking at how we hold ourselves? It's a pretty amazing thought, isn't it? That the very first step to a life with fewer headaches might just be as simple as paying attention to your posture.
If this explainer helped you connect some of those dots, please do us a favor and like, share, and subscribe for more insights like this one. And of course, if you need some help, you can always visit our clinic. Thanks so much for watching.